Could you walk us through a little bit of what that assessment actually looks like in detail?
Sure. So it gets a little bit, there are a few things that can change about it depending on what the issue ends up being. But essentially, what we do is we assess person's cognitive ability. And what that means is we look at their intellectual strengths and weaknesses. Now, it doesn't matter if you have a genius level IQ or high average IQ or a normal IQ in the average range. Everyone's going to have different areas of strength and weakness. So we want to find out, how do you learn? What's the best way for you to process information? And do you have the ability to be able to perform at a certain level on a test like the LSAT, which is reading intensive? So that cognitive assessment establishes a baseline where we see, okay, this is a level that a person should be able to perform at when they're taking a test like the LSAT. And then if we give these other achievement-based tests where we look more specifically at academic functioning, reading is something we look at a lot with the LSAT because it's very reading intensive. If we see that there are discrepancies and certain patterns of results, then that lets us know that a person might not be able to perform to the level that their cognitive ability suggests. So we give tests of cognition, tests of achievement. In the case of an ADHD evaluation, then we give a specific test that just looks at attention. And then in the case of an anxiety or depression type of issue, we give an additional test that looks just at that. So, it can vary a little bit, but that's a typical evaluation process that I described.
Thanks for tuning into the show. Please subscribe if you haven't done so already to be notified of new episodes as I release them. And feel free to reach out if you need anything at all as you move forward with your prep. I'm happy to help however I can. In the meantime, I'll wish you all the best and take care.